Go.
Okay, so this is Dr. Bowie, and I created this KONE-X Active Mat to help people with balance, and also it will help improve posture. And really what it does is it activate the proprioception, or the sensors on the bottom of your feet, so that you can be well aware of your surrounding. By wearing those cushioned shoes all the time is good, and it's protecting your feet and make your feet feel cushioned, but it does not allow your feet to feel the ground or the surrounding. So the purpose of this mat is to wake up those sensors, those cells that giving you the feedback more than what's inside the shoe, or even on the floor. You don't really feel much. So the difference would be here when you're standing on the ground on the tile, you shift your body weight to the left or to the right, you really don't feel the position of the foot and the amount of pressure that your foot feel. As soon as you step onto the mat, you feel all these sensors are activated. You feel which area of the foot has more pressure, which area of the foot has minimal pressure, for example, the arch. And so you feel you're activating these proprioceptors. And in terms of learning or reinforcing our brain to learn for a certain movement, when you activate the proprioceptors, the learning takes place faster. And so a couple of different exercises that we can recommend for our clients, our patients to do, which will help with their balance. The first thing I would assess them is to see how they are able to stand on one foot. And some people can stand with their one foot for 30 seconds or more. That's great. But really the goal, if you're like, I call it 30-30, so it's easy to remember. If you're 30 years old, you should be able to stand on one foot and with your eyes closed and stand on one foot for 30 seconds. That's the minimum. But some people can't do that, and they need to work on their balance. And the older they are, the balance, you can lose their balance. How do we regain that? How do we get your balance to be better? So the mat will help make that process faster for you to regain the balance by learning the balance using the mat. So you have the patient stand on the mat and work on their balance. So now, yes, they can do it on the tile floor as well, and they will build it up as well, but it takes so much longer because the sensors are not active. So that's the reason why you want to work on the balance on this mat. And that's why the secondary name of this mat is the balance activating mat as well. Now the mat will create a little bit of instability as well because of the foam. So it's sometimes the first time standing on it is like, whoa, it's wobbly, versus standing here is not so wobbly. But this instability will build stability. So by standing on this and practice and learn, you will be much more stable down here. Okay, so we're gonna go into the exercise. Let's press pause.